right, so here now to help us dig deeper, Wolf, is Dr. Mary Claire Haver, an OBGYN, a menopause certified practitioner. She is also the author of the New York Times bestseller, The New Menopause. I follow her on Instagram, and she is a leading voice in this area. Dr. Haver, I want to start with your reaction to this. How significant is it?
I feel like this is a very big win for women and for women's health. We've gone to the FDA for over a decade asking to have these black box warnings modified because it really represents a lot of fear for patients. So I had multiple times in my clinical practice where I would prescribe something like vaginal estrogen, safe, efficacious, really almost no systemic absorption. She goes to the pharmacy, she gets her medication, she gets home, she opens that warning, and she's terrified and calls me in a panic. And I think now we can replace panic with precision.
So let's talk a little bit more about that replacement of panic with precision and what this means practically for women in menopause or even perimenopause, because now from everything I gather, even if you're in perimenopause, it might be a good idea to look into hormone replacement potentially.
Potentially. So we know that the benefits of hormone therapy, definitely quality of life, there's no question. It is the gold standard of treatment for hot flashes, which can begin in perimenopause. It's also FDA approved for the prevention of osteoporosis, therefore hopefully preventing up to 50% of fractures of long bones in our bodies as we age.
And tell us a little bit more about the considerations you make as a doctor in terms of what a woman might be going through and what kind of hormone replacement you might provide them, because this really is about precision and nuance.
Right. So there's a lot of nuance to this. When a patient comes in and she's having hot flashes, night sweats, vasomotor symptoms, the conversation initially begins with what are her goals, what are her risks and benefits, does she have any contraindications like a tumor that is being fed by estrogen, like a breast cancer, does she have a recent history of a thromboembolic, like a blood clot? You know, those are all things we have to consider. However, for most women, at least before the age of 60, it is safe and beneficial and will give her the best chance of the best quality of life.
And just to reset for our viewers, because I remember my mom going through this, she actually went off of hormone replacement therapy because of this Women's Health Initiative study. Yeah, exactly. And I remember at the time it was a big deal. There was a lot of fear that these hormones could cause breast cancer because of this study. Just help us understand the different iterations stemming from that study.
So there are multiple forms of estrogen therapy, and unfortunately the black box warning extended to all. So when we talk about nuance, we have local estrogen therapy, like for the vagina, the vaginal area. Most women will suffer from genital urinary syndrome of menopause, which causes recurrent UTIs, pain, discomfort, dryness. And so almost all patients, I would say 99% plus, are candidates for that particular therapy without any of the warnings. When we talk about systemic, again, it gets more nuanced. How old is she? How long from her menopause has it been? What are her personal goals? Does she want to reduce her risk of osteoporosis? You know, do we have a bone density? So it just really opens the door for a lot more effective counseling. And also a lot of clinicians were scared when they saw the warning. We have a whole generation of physicians who really haven't been trained how to prescribe hormone therapy safely.
And what were the flaws, though, in that initial Women's Health Initiative study that led to this, the 23 years of fear, essentially?
Sure. So the average age of the patient in the study, because the end result they were looking for was heart disease. Is she going to have a heart attack? You know, is this medication truly going to prevent a potential heart attack in a woman? So the average age was 63. Most women start menopause hormone therapy at their menopause, which is somewhere between 50 to 51. So it's a much older population. This population also had several pre-existing cardiovascular risk factors. Most of them were obese, a lot of them smoked, etc. And so while they started the therapy, they were older. A lot of them may have had pre-existing breast lesions that hadn't been identified, and then so what they found was in the estrogen only arm, so women who had had a hysterectomy or didn't have a uterus, they were allowed to get estrogen only. They actually had a decreased risk of breast cancer. And it was the combination of a very specific drug that really isn't used in modern hormone therapy, this estrogen, it was a Premarin and Provera combination called Prempro. They saw a very slight increased risk in breast cancer. But again, these were much older patients. When we risk stratify and looked at the ages and said, okay, what did the 50-year-olds do? We did not see an increased risk in the first 5 to 7 years of therapy.
But yet, there were these black box warnings.
For all, even for the vaginal products.
Preventing women like my own mother from getting the treatment that really could have helped her during this tough time, and you've gone through all the symptoms, I mean, with insomnia and
Yes.
the bone
Body
density,
composition
body
changes,
composition.
bone density, musculoskeletal issues, cholesterol going up.
Right.
It's just really there's not a cell that's not affected in our bodies from this change.
From menopause. And I just want to ask you, while we're on this topic, there is this new FDA approved once a day menopause pill that works without hormones
Sure.
to help with hot flashes. What are your thoughts on
Yeah,
that?
so we have a lot of non-hormonal options. So that's specifically to treat vasomotor symptoms, the hot flashes, the night sweats. So it affects a certain area of the brain that controls our temperature regulation system, which really goes cattywampus in perimenopause and early menopause. And so it's a neurokinin receptor that the new medication can block and stabilize so you don't have the hot flashes and night
So
sweats.
you
So
think
for
this is a
someone
good thing?
looking for a non-hormonal option, this would be a great option for her.
Dr. Mary Claire Haver, thank you so much for helping us better understand the significance of this announcement from HHS and the impact it will have on so many women. We'll be right back.